If you've ever looked at your child and thought, maybe it's nothing, but what if I'm missing something? Then this is for you. Maybe they keep getting ear infections. Maybe they snore so loudly you can hear them from the room next door. Or maybe they're just not hearing you or speaking the way you expected them to. As a parent, that uncertainty can be exhausting. So in this video, I'm going to walk you through 7 signs that you should really not ignore. And I'll explain exactly when it's time to see an ENT surgeon. My name's Vikas Acharya. I'm a consultant ENT surgeon based in Hertfordshire, North London. I look after children with problems involving the ears, nose, throat, tonsils, adenoids, and also their hearing, breathing, swallowing, and recurrent infections in general. A big part of my work is helping parents understand the difference between something that is common and temporary and something that deserves a closer look. So let's start with the question almost everyone asks me when they first see me. If your child keeps getting repeated ear infections, listen to this before you call it just bad luck. 3 ear infections can be a pattern, not just a phase. This is one of the most common reasons parents end up in my clinic room. When I talk to parents about ear infections, I always say this. 1 infection may be common, but repeated infections tell me I need to look deeper into this. Here's when I start paying closer attention. Frequent ear infections, especially if they keep returning over months. Persistent ear pain or tugging at the ears. Fevers with every episode. Fluid behind the eardrum that doesn't seem to clear. Antibiotics helping only temporarily. Think of the middle ear like a small room behind a closed door. That room needs air to move in and out properly through a little passage called the eustachian tube. In children, that tube is smaller and more horizontal, so it blocks more easily. When it blocks, fluid can build up. And when fluid sits there, it becomes the perfect place for an infection to fester. What parents often fear is, does this mean that there's something seriously wrong? Usually no. It does not automatically mean there is major damage happening. But if infections are frequent, they can affect sleep, comfort, hearing, speech and language development over time. Okay, let me do that again. This is exactly why I don't want parents to wait until a child is miserable. If the pattern is recurring, I would rather assess early than let the ear become a revolving door of infection. Antibiotics, temporary improvement, and then infection again. Sometimes not listening is actually not hearing. This is a big one because hearing problems in children are often quiet problems. They don't always announce themselves dramatically. Parents may tell me, the child says what all the time? She doesn't respond unless I'm facing her. The television volume keeps creeping up month by month. His nursery mentioned he's got some speech delay. Sometimes I think she hears me, but sometimes I'm not sure. One of the common reasons for this is glue ear, which means sticky fluid sitting behind the eardrum. Imagine trying to hear someone through a window. I often explain it like this. Imagine trying to hear someone clearly through a window covered in condensation. The sound still gets through, but it becomes muffled. Now here's the reassuring part. This doesn't always mean permanent hearing loss. In most children, the issue is temporary and treatable, but it's still important because during childhood, the brain is learning language at a high speed. So if sound is muffled for too long, a child can miss pieces of speech, pronunciation, enunciation, and classroom instruction. I would strongly consider an ENT assessment if you notice delayed speech development, inconsistent response to sounds, frequent need for repetition at home or at school or otherwise, the nursery or school becoming concerned about attention or communication. Sometimes the real issue is not behavior. Sometimes the child is doing their best with fuzzy sound input. And once parents understand that, so much guilt and frustration lifts from both of you. If your child sleeps with their mouth open every night, this is for you. A lot of parents are surprised when I say this, but a child should not snore loudly every night. Occasional noisy breathing with a cold or a flu is one thing, but if your child snores most nights, breathes through their mouth all the time, sleeps restlessly, sweats a lot in their sleep, seems to gasp, choke, splutter or pause at night time, wakes up tired, irritable, or struggles with concentration, then I start thinking about enlarged tonsils, adenoids, or another blockage of the upper airway. I explain it to families like this. Imagine trying to breathe through a straw that's being gently squeezed. You can still get air through, but your body has to work much harder. And that's what some children are doing at night time. Parents often worry, will this definitely mean surgery? The answer is no, not always. An assessment doesn't automatically lead to an operation. Sometimes we monitor, investigate further, and sometimes treatment is much simpler than parents expect. But I don't like parents dismissing these symptoms because poor quality sleep can affect mood, concentration, behavior, growth, daytime energy, learning and concentration. So if your child looks tired despite a full night in bed, I want you to think not just about how long they slept, but how well they breathed during sleeping. If your child is always on antibiotics for their throat, pause here. Tonsillitis is one of the conditions parents can almost predict before I say the word. They'll tell me every few weeks it happens again. The signs usually include repeated sore throats, pain on swallowing, fever, swollen glands in the neck, bad breath, missed school and repeated courses of medications from the GP. Your tonsils are part of the body's immune defense. They're like security guards at the entrance of the throat, sampling germs that come in through the mouth and the nose. But sometimes, instead of simply helping, they become repeatedly inflamed themselves. What matters to me is not just one bad infection, it's the pattern over time and how much it disrupts the child's life. I look at how often it happens, how severe each episode is, whether the child is struggling to eat or drink, how much school they're missing, how many times they need antibiotics, and whether sleep and breathing are also affected. Many parents are frightened that seeing an ENT surgeon means that I'll immediately recommend taking the tonsils out. That's a very common fear. And I want to be very clear. My job is not to rush to surgery. My job is to assess properly, explain the options, and decide whether the benefits of treatment outweigh the downsides of it. And sometimes reassurance is enough. Sometimes monitoring alone is appropriate. And sometimes recurrent tonsillitis has become such a burden that treatment can genuinely help improve a child's quality of life and also that of the family. Not every permanent cold is actually a cold. Children get plenty of colds, so I completely understand why parents sometimes normalize nasal symptoms. But there's a difference between frequent viral infections and a nose that seems blocked all the time. I would recommend or want an ENT opinion if a child has persistent nasal blockage, ongoing mouth breathing, a constantly runny nose, thick mucus for weeks and weeks, facial pressure or sinus type symptoms, one-sided foul smelly discharge, especially in a younger child. The last one is really important because in small children, one-sided foul-smelling discharge from the nose can sometimes mean a foreign object or foreign body in the nose, and that's exactly the kind of thing parents often don't realize is in there. I often use this analogy. The nose is like the air conditioning and filtering system of the body. It warms up air, it moistens it filters particles, and it helps proper breathing. If that system is constantly congested, children may eat poorly, they may sleep poorly, they may sound nasal when speaking, and end up relying on mouth breathing. Now, is this always serious? No. Sometimes it's just an allergy. Sometimes enlarged adenoids. Sometimes recurrent infections. Sometimes it's just nasal irritation. But if a child seems blocked more often than clear, I don't want parents assuming they'll simply grow out of it without anyone checking. The key message is this: persistent symptoms deserve a proper assessment, even if they look ordinary at first glance. These two last signs are the ones I really don't want parents brushing off. Sign 6. Persistent hoarse voice, noisy breathing, or trouble swallowing. If your child's voice stays hoarse for more than a few weeks, or they have pain or difficulty on swallowing, coughing or choking with food, noisy breathing when they're not unwell, a voice that sounds persistently different, then I want that assessed. Children can strain their voices, of course, and many causes are treatable or temporary, but the throat and voice box should be taken seriously, especially if symptoms linger longer than expected. I tell parents to think of the voice box like a musical instrument. If the sound changes briefly during a cold or a flu, that's expected. But if the instrument keeps sounding different or wrong long after the cold and flu-like symptoms are gone, we need to inspect it. Sign 7. A neck lump, recurrent heavy nosebleeds, or one symptom that simply doesn't make sense to you. This is where instinct matters. If you feel a persistent lump in the neck, or your child has frequent severe nosebleeds, or there's something asymmetrically persistent or just unusual, please don't ignore that. Most of the time, these turn out to be benign causes such as reactive glands after an infection or irritation or dryness. But the rule I want parents to remember is simple. Common things are common, I don't dispute that, but persistent things should still be examined. You don't need to panic. You also don't need to sit at home worrying while hoping it goes away. Reassurance is valuable, and if something needs treatment, early review is always better than a delayed review. So the big takeaway from this video is this: not every ear, nose, or throat symptom is an emergency, but patterns matter. Repeated ear infections, hearing concerns, speech delay, loud snoring, constant mouth breathing, recurrent tonsillitis, chronic nasal congestion, voice changes, swallowing issues, neck lumps, persistent heavy nosebleeds, they're all signs that your child may benefit from an ENT assessment. As a parent, you're not overreacting by asking questions. In fact, very often, the earlier we assess a problem, the easier it is to explain, diagnose, monitor, or treat. My goal is always to help families understand what is normal, what needs watching, and what should not be ignored. If you found this video helpful, please subscribe for more content like this, because I share practical information to help parents make confident decisions about their child's health. If you'd like a consultation, please follow the link in my bio. And if you know another parent who's worrying about their child's ear, nose, throat, snoring, hearing, or recurrent infections, please share this video with them. It may give them exactly the reassurance and clarity that they need.